kicks off Women's Health Month, and every weekend we're talking about some of the biggest health topics affecting women. This morning we're speaking to the minds behind a one-of-a-kind weekly podcast dedicated to educating and informing women when it comes to their health. It's called SheMD, and it's hosted by former designer and entrepreneur Mary Alice Haney and leading board-certified OBGYN and doctor to the stars, Dr. Aliabadi. Her patients include SZA, Rihanna, Olivia Culpo, Khloe Kardashian, and more. They both are joining us this morning. Thank you so much for being with us, ladies.
Thank you for having us.
We've got two rock stars in the house, and I love that you're health rock stars. Okay, so SheMD, such a hit. Tell us the inspiration behind it. How did you guys start this?
You know, I've been in medicine for 30 years and in women's health for, 25 years. And one thing I've noticed is that women's symptoms get dismissed. Women are not taken seriously when they go to the doctor. And if you spend a day with me in the office, you'll know exactly what I'm talking about. So, when we met, I decided, basically we decided to bring this information to women at home so they can be their own health advocate.
Yeah, and I think most women share in that experience. We've all gone to the doctor and felt dismissed.
And we're told it's hormones.
Right.
You're crazy.
Are you pregnant? The question that doesn't have anything to do with anything we're doing, right?
Or it's in your head. Why are you so anxious?
Yes.
I had a patient with precancer cells growing in her abdomen, and she was told by her gastroenterologist that what's wrong with a little bloating? You look really good.
Wow.
So listen to yourself. That's the one thing we really wanted. I met her on Molly Sims's podcast, this amazing woman, and I just thought to myself, if I can get her into every woman's ears in America and worldwide, then we can arm them to be their own health advocate, and that's why we started SheMD.
Oh, this is so needed, ladies. Okay, so one of your first episodes was with Grammy Award-winning singer SZA, and she talks about her breast cancer risk, so let's take a listen.
So when she first presented to my office, I didn't know the density of her breast, and I just knew her height, weight, family history. And she was not, at that time, she had not been tested with genetic testing. So when I calculated her lifetime risk and did a genetic test, her gene mutation was completely negative, but her lifetime risk, because of her family members, was really high. Do you want me to share that number or no?
Sure.
Her first lifetime risk calculation was 53%.
How did you feel when you heard that?
I didn't understand, so it didn't really bother me now. No disrespect.
You see what I deal with?
Well,
And
but
I can't
this
see
is the point. This is actually really the point.
Tell us how you go about doing this with your patients and the importance of it.
So it's very important. Just like you know your name, your date of birth, you need to know your lifetime risk of breast cancer as a woman. It's that important. So every single patient who walks into my office gets her lifetime risk calculated, and if they have a family history of cancer, I do the Myriad MyRisk genetic test, and I look for 48 cancer-causing genes in my patients. So this is routine, and of course, the most important part of this is you have to take a detailed personal history and a family history on these patients.
Recently, Olivia Munn came out with her breast cancer journey. Dr. A was her doctor that saved her life, and we wanted to give every woman those tools. They're on our website, they're free, the lifetime risk, the genetic test, and then we have an action plan. So once you get your lifetime risk, you know what to do with it.
This is amazing, and I think this is a new part of medicine, at least for those on the outside, realizing that there is even something that could tell you that you're at a higher risk for breast cancer.
You know what's sad? This is not new. I've done it for years for my patients.
Wow.
It saved my own life years ago, like 5 years ago.
Amazing.
But I don't have a voice, but my patients do, and I'm so grateful for Olivia Munn for doing this.
I think we all look to our favorite celebrities, and that's how we learn about a lot of these things and that they are available.
Yeah.
This is very important. Okay, so tell us about the importance of this conversation about breast cancer right now, because as I said, some of the things that we're talking about, I'm like, oh, this is new, and you're like, no, they're not. People just don't know about them.
So let's start from the basics. 1 out of 8 women will get diagnosed with breast cancer in her life. That's 12.5%. So if you're an American woman, you have a 12.5% chance of getting diagnosed with breast cancer. Now, other factors affect this percentage. Your height, your weight, your family history of breast cancer, whether or not you've had a breast biopsy, the density of your breast. So many factors go into play. And, we start at 12.5, but these risk factors slowly increase our risk assessment. And if your lifetime risk is 20% or more, you fall into the high risk category, and you have to start breast imaging as early as 30.
Wow.
And we also include MRIs. So a lot of women, you know, when they go to their doctor, they're like, you're too young. You don't need a mammogram until 40.
That's what they tell us, right?
Yeah.
It's not true.
Wow.
It's not true.
We want to arm them with this information so they can go to their own doctor and say, hey, this is my lifetime risk. This is what you need to do about it.
Yeah, because often even if you question your doctor, you don't feel confident enough once they say, oh, no, you don't need to worry about that. You're like, okay. Like,
yeah, that doesn't work. You need to empower women to be their own advocate. But in order to empower them, you have to educate them. And that's exactly what we're doing on this podcast.
This is so life-changing. Okay, and the beautiful thing on the podcast, you guys don't just talk about breast cancer. You talk about everything. You talked to Olivia Copel. We talked about endometriosis, Toni Braxton, her journey with lupus, and then recently you had celebrity baby nurse Nanny Connie about what she has moms deal with postpartum depression. You guys talk about everything.
We talk about everything, and I just want to emphasize that let's take PCOS, right? It affects 15% of women in their reproductive age. 90% of these women are never diagnosed.
Wow.
Endometriosis affects 10% of women. These two conditions are the top causes of infertility on the planet. It takes doctors in this country 9 to 11 years to diagnose endometriosis. So this is not just a breast cancer issue. It's an endometriosis issue. It's a PCOS issue. And that's why it's so important to know your body, understand what's going on, and be your own health advocate.
Mary, how do we listen to the podcast?
Well, you listen to it or watch it. You can watch it on YouTube, or you can listen to it wherever you get your podcasts, Apple, Spotify. And we have a website that, again, has our risk calculator, the cancer genetic test, the action plan, SheMDpodcast.com. So we really are, you know, this is my life mission. It's her life mission. We want to give women all over the world the power to be their own advocate.
Wow. Well, Mary and Dr. A, I appreciate you guys so much for this conversation. I'm taking notes in my head for my next doctor's appointment. Thank you for being with us. And guys, you can find all of the information for the SheMD podcast on our website. Go to kcalnews.com/seen on TV.